Good morning, everyone. Thanks again for joining us for our special live stream discussion of the coronavirus COVID-19. I'm Bob Harvey. I'm the president and CEO of the Greater Houston Partnership. We know this issue is dominating discussion on media, social media, and in the workplace, and that's why we're holding today's discussion. How should companies be thinking about the coronavirus? How should they be responding? What's the latest data? What's the science behind this? It's an issue for business leaders as well as everyone else. While many of you have taken preliminary steps, you may be wondering what's next, and that's what we've designed this program to talk about this morning. So for today's discussion, I'm going to open with a brief summary of the policy areas that many companies are thinking about and a bit about what we're hearing from some of our board member companies with whom we've been having this discussion for the last several days. Then I will pass the mic to Dr. Umair Shah. Dr. Shah is the Executive Director of the Harris County Public Health, and also to Dr. David Percy. Dr. Percy is the City of Houston Public Health Authority, and he's the Director of the Emergency Medical Services for the City of Houston. They will give us an update on what they're seeing, and I want to thank both Dr. Shah and Dr. Percy for being here today and for their efforts to ensure the public is well informed about this outbreak, and particularly for coming to talk to the business leaders today about the subject. So shifting into how businesses can and should be thinking about the coronavirus, each and every case is different, and you have to evaluate your situation, your workforce, and all the factors surrounding your business. Today, I will focus on a general framework of thinking so you can make smart decisions about your company. I'll break it down into 5 buckets, and we'll move through the 5 buckets fairly quickly. 1, employee workplace hygiene and safety. The second is travel policies. The third is policies for meeting and large gatherings. The fourth is sick and PTO leave. And the fifth is teleworking. I'll walk through each of these quickly, but this is what it boils down to, and the medical folks will talk about this in a bit. How do we minimize the risk of exposure? How do we lower transmission rates? How do we lessen the risk of spreading the virus? So this takes a community-wide effort, and businesses are a key part of the community. So let's turn first to employee and workplace hygiene and safety. It all starts with the point that you must encourage your employees to stay home if they're showing respiratory illness symptoms, or if someone in their household is showing such symptoms. Encourage them to stay home. And then you know the basics. Wash your hands frequently, stop shaking hands, clean your workplace frequently and properly, avoid close contact, put distance between yourself and other people. You've heard about social distancing. That's what this is about. The CDC has great advice on what workplaces should do. Note that the partnership has compiled an online resource with a number of good toolkits for businesses to think about how to respond to the virus. This page is located at houston.org/coronavirus, houston.org/coronavirus. Now let's turn to business travel policies, both domestic and international. We've surveyed our board over the last several days, and we've received about 30 responses. These are largely larger companies, but also some small to medium businesses. On the travel question, 82% have modified or outright banned non-essential domestic travel. 82% modified or outright banned non-essential domestic travel. 97% have instituted such policies for international travel. On the domestic side, we're seeing several scenarios develop. Some have outright domestic travel bans. Some have bans on non-essential travel where essential travel must be approved by a senior executive, in many cases very senior. Or there's a hybrid that bans most travel except for client travel. So this gets tricky for client service companies, particularly when we look at audit and tax firms. We know this is their busy season, but many of those firms as well are rethinking their travel policies. Now, what about those who have employees working off-site and more operational settings? What we've heard from the construction industry, from refining and petrochem, is that they're designating project teams. They're splitting groups into 1 or 2 or even 3 or 4 teams with only one team on site at a time, and they're prepared if they have to send that team home to be self-quarantined and have the other team come in and take their place. This idea of identifying work groups doesn't just apply, frankly, in those kind of operational settings. It can also apply in office settings where you have a critical operation that must be maintained. The goal is to have the ability to quarantine a team, yet remain operational. On the international side, it's more clear-cut. Most are outright bans, as I mentioned, with some narrow exceptions for client travel with executive approval. Now, turning to personal travel, this gives some people some heartburn that we're digging into people's personal lives. But let's think about it for a minute. You have a responsibility to protect your entire workforce. Therefore, you care where your employees are traveling, even on a personal basis. Several companies have implemented travel logs. Some are calling it a travel registry, where employees must report any personal travel. So let me illustrate the argument and the case for this. Say an employee next week on spring break travels to a city with no known outbreak. They come back to Houston, they return to the workplace, and then 3 or 4 or 5 days later, there is evidence of an outbreak in the city that they visited. You're going to want to be able to talk to that employee about the specific circumstances of their visit to that community and decide whether that employee needs to be self-quarantined, needs to leave the workplace. The only way you're able to do that is if you've kept a record of where your employees have traveled. So given the incubation periods and testing windows, it's very important that we know where our employees have been, frankly, over a 2-week period. So we'll talk about more this issue when we have the medical folks up here. But this issue of self-quarantining for 14 days when there has been risk of exposure is a key point. Now, what about policies for meetings and gatherings? Here, about 80% of the respondents to our survey indicated they have placed such restrictions. Many have placed outright bans from attending outside business functions, but there are also many that are limiting the number that may be in attendance at an event. Those numbers can be as small as 10 or 15. We at the partnership have limited meetings to 50 or fewer. You can decide what size is most appropriate. Most of these policies have knocked out attendance at major conferences, period. So think about how you're applying this to conference events. Of course, we're seeing a large number of cancellations across this city of meetings and conferences. It's all about reducing the risk of exposure and transmission. That's the key thought we must bear in mind with meetings. Fourth area, sick and PTO policy. Only a third of our companies in our survey have made changes to their policies, but frankly, many of them had very liberal policies to begin with. So I want you to think about, again, how your PTO policy is influencing your employees' behavior at a time when you're encouraging them to stay home if they have any hint of symptoms. So let's think about this. Sick people should stay home. Clearly, sick people that are showing respiratory symptoms should stay home. So how does our PTO policy encourage that behavior rather than discourage that behavior? Potentially exposed employees should stay home. Someone who's attended an event, they have subsequently found out that there was a person with these symptoms at that event. We want that person, again, to stay home, be self-quarantined for at least 14 days. Another group to think about with your employee policies are those employees who fall within these categories that are more at risk to this particular virus. As we know now, anyone with an existing respiratory issue is more at risk, much more at risk. Anyone with immune system deficiencies, much more at risk, as well as the older worker. People talk in terms of people over 60, 65, 70, you hear different numbers, but over a certain age, you're much more susceptible to the severe impacts from the coronavirus. So think about how you're directing your employee efforts towards those at-risk employees. And it's not just the employees, frankly. Think about employees who have family members who fall in these categories and therefore have a particular concern about not bringing this virus into their household. And then lastly, let me turn to teleworking policy. This is an area that's getting a lot of attention. 65% of our survey respondents already had some form of teleworking policy in place, but many are now rethinking that policy to apply in this instance. Again, we're thinking about how do we avoid close contact with others, and teleworking is an important element of how we address this. We have to begin thinking early and quickly about what roles can be done at home, out of the workplace. Do people have the laptops or other equipment they need to be productive at home? is your IT infrastructure capable of handling the increased load if people are working from home? Now, we here at the partnership have instituted teleworking just here in the last few days, and we are having to go through those steps ourselves to make sure everyone is equipped. So let's go back to the 5 things to think about: employee hygiene, travel policies, meeting and large gathering policies, sick and PTO leave, and lastly, teleworking. As I mentioned at the outset, we have a page of reputable toolkits on our website at houston.org/coronavirus. Now, we told our staff with respect to teleworking that the emphasis is on the latter half of that word. It's working. We are trying to create an efficient, effective workplace at home, and we're trying to train our employees themselves, but how we interact together to make that efficient. So teleworking is working, and it's important for all of us that we remain productive at this point in time. Now I'd like to pass the meeting to Dr. David Percy, who will join us. As I said at the outset, Dr. David Percy is City of Houston Public Health Authority. He's Director of EMS for the City of Houston. Dr. Percy, can you join me on this podium? Thank you so much. Thank you, sir.
Thank you so much. Yes. Okay, so I think everyone has a fairly good idea what's been in the news and what's been going on, and you've seen that the city and the county have taken some pretty drastic steps to reduce large gatherings. And so a lot of questions come into, well, can we still go to work? And I think that the mayor and the judge have been pretty clear, and yes, people should absolutely continue to work. One thing that I want folks to sort of start getting their heads around is that we need to anticipate that this may be more of a marathon than a sprint. And so while the mayor has talked about, large gatherings until the end of March, that's because this gives us some time to see how this evolves. And if things start looking better, then maybe the end of March will be the end of all of this, these steps that we're taking. But should the situation go in a different direction, we may then have to take different actions. So for now, the prudent thing to do would be to start thinking about this being more of a marathon. So that being said, a lot of the things that we were just talked about in terms of working from home and telecommerce and so on and so forth are very important, and I would just advise folks to start thinking about this as a more of a long-term thing than a short-term fix. Hopefully that won't be the case, but if it is. In the meantime, when people do come together to work in large office buildings, in fact, in the room I'm in right now, there's a relatively small number of people for a fairly large amount of space, and with the exception of maybe two or three groups here, we're all at least 3 to 4 feet apart, and that's the way it needs to be. So when you're having meetings, you can do a couple of things. If the meeting space that you know that you're going to have is relatively limited, to whatever degree possible, you might want to reduce the number of people invited to that meeting. Or you may want to find a larger room. A good recommendation is for people to sit in every other seat if you can do that. People can still exchange ideas, they can still have a conversation. We just don't want people right up close to each other. Remember that this virus is new, and so while it's pretty clear that it can be spread by coughing, it's still a little bit unclear as to whether or not somebody who has absolutely no symptoms at all, how much virus they may or may not be able to spread if they don't even know that they're sick. We have good reason to believe that they can spread some, but the important thing I think for employers to understand is that what pushes a virus through a community isn't the people with minimal symptoms that are shedding a little bit of virus. It's the people who clearly have symptoms that are shedding much more virus. That's what pushes it through a community. And a concept for people to try to get their head around it. In public health, we talk about a value called an R0. When you see it in print, it's a capital R with a small 0 next to it. And this is a mathematical value that says that if a person who is infected with an illness were to enter a room of people who have no immunity at all, how many people would that one infected person infect? And so with the seasonal flu, that number is about 1. It's a little bit above 1. And if you think about it, if you put on your mathematician hat, if the number is greater than 1, then that virus is going to continue to propagate through a community, and if it's less than 1, it will probably die out fairly quickly. With this virus, we're still learning, it looks like the R0 value is greater than 2. So this is a virus that does spread fairly easily. Now that, put that in perspective, measles is somewhere between 7 and 10, all right? So it's a little bit more infectious than, say, or easily transmitted, I should say, than the seasonal flu, but it's not as easily spread as measles. So that being said, a lot of our tried and true public health strategies to slow down viruses absolutely should work. And so this is why you're hearing all these things time and again about cough into a tissue, throw that tissue out. If you don't have a tissue, cough into your elbow. I've noticed that a lot of people have stopped shaking hands, and that's good. We can still greet each other, whether it be the elbow bump or whatever folks are doing. Just avoid the person-to-person contact. But commerce does need to continue going forward. People should feel comfortable going to work and meeting with each other. The other thing is, how you get to and from work, and mass transit is a challenge for a lot of folks in terms of social distancing on that, and we're going to be having some conversations with our friends in mass transit about what they can do. I will tell you that Metro has already stepped up in cleaning the buses and cleaning the trains, and that is very important and very helpful. But we need to start talking about potentially other ideas. That's their area of expertise, so we're going to learn a lot from them as we move forward, and I leave it to our professionals in Metro to help guide us. But the basic concepts of continuing to work in social distancing. Now, with the cancellation, a lot of the schools, the ISDs, have chosen to close, and that's going to put another burden on folks in terms of childcare. One of the things that, the thing about children is that fortunately, this virus does not seem to make children terribly ill, which is a blessing. But they're still children, which means they're still able to get the virus. They seem to not get as ill. So the challenge with children is that they could have very minimal symptoms and easily be able to spread the virus to grandma. Now, grandma is at risk. And at the end of the day, all of this is about saving lives. And I think people need to keep that in mind, that this is about saving lives. We've seen the scary statistics of the percentage of people who are dying. It is about, overall, it's about a 2 to 2.5% every day. The numbers come out, it changes a little bit. Today, if you look at the Johns Hopkins website, it's actually a little bit above 3%. But I will tell you, I look at that twice a day, every day, and that value fluctuates a little bit. So to put that in perspective, the seasonal flu has about a 0.1% case fatality rate. So this is around 2%. And I will share with you that I had fully expected that number to decrease by this point, but it seems to be holding steady. But it is the elder folks, so it's really people over 50. So I need to be careful as I use the term elder, but people over the age of 50, because I'm in that group now. And so I don't feel elder, but people over the age of 50 and by decade of life, from 50 to 60, 60 to 70, 70 to 80, 80 above, the risk gets higher for having serious consequences and running the risk of having a fatal outcome. So that's the population. And like I pointed out, so I'm in that age group. I'm over 50 years old, and I am gainfully employed. And so I am no less at risk than anyone else over the age of 50 that is gainfully employed. And so I would like to think that people in my age group are a vital part of the workforce. And so it's not just nursing home patients that we're thinking about. They are at the greatest risk because they tend to be much older and they tend to have lots of other medical problems. That's why they're in the nursing home. So yes, they are at the highest risk. But able-bodied people with jobs that are in their 50s, 60s, and 70s are also at greater risk than children. So part of all these strategies is to protect and save lives in that group of people. And I see that my colleague from Harris County has arrived, so I will turn the podium back over. Thank you.
Thank you, Dr. Percy. We'll have you back up here in just a minute. I do want to introduce again Dr. Shaw. Dr. Umair Shaw is Executive Director of the Harris County Public Health. He's someone we're getting to know pretty well. Dr. Shaw, thank you for being here this morning. I'll turn the podium over to you, and then we'll bring Dr. Percy back, and we'll have a conversation. Thank you.
Thank you, Bob. Thank you so much for your leadership and all the strong work that GHP does. And thank you to our businesses. I really appreciate the opportunity to speak to all of you. I'm going to do my best not to duplicate what Dr. Percy said, but as you know that Dr. Percy is a little bit taller than me. Dr. Percy has really highlighted a number of aspects of this, and I really want to commend Dr. Percy for his leadership. He and his team have done a fantastic job and have really worked well with city and county and our region public health aspects of what's going on. And he has very nicely summarized all the different moving pieces of what's happening. So I'm going to provide some perspectives that are complementary to what David just presented, and really an opportunity for all of you to recognize what we are doing and what has happened. And so I'm going to start with that global context, and as you know, we've been following this unfolding of events. It feels like a slow unfolding over time. As you know, December is when things were playing out in Wuhan. It doesn't seem that long ago, but it was. It was January when we started to watch things here in the U.S., especially here locally. Our teams for the last 70, 75 days have been managing, monitoring, and really leaning forward in so many different ways. And then as we move from what was happening in China to what was happening in then Asia, but then across the globe and other countries like Iran and certainly Italy and other parts of Europe, we started to recognize that things were also happening here in the United States. And so in the U.S., we had the first case in Seattle. Then we learned of, and it was travel associated. So we said, okay, that's okay. And then we heard of a Chicago traveler, a spouse who hadn't traveled, had human-to-human transmission. That was a significant milestone. And then we started to see repatriated individuals start to increase numbers in the United States. Then we started to hear about unexplained. We can't figure out where somebody may have been in California and Oregon and even in Florida. And we started to really be concerned that we were moving from linked to an international travel or linked to a confirmed case to what we were concerned about all along was community spread. As Dr. Percy has mentioned, we moved to this real dynamic of what was happening across not the globe, but now in the U.S. And that meant that in Seattle, there was another milestone, as you know, in a long-term care facility, nursing home, and there were a significant amount of individuals who were impacted and even, unfortunately, deaths. And as we started to see this unfold, Dr. Percy and I and our teams have been moving in this messaging from it's not a matter of if, it's a matter of when, to it's a matter of now. And so just a couple of weeks ago, Fort Bend County confirmed the first travel-associated case in our region. And if you then move forward in the process with subsequent confirmations in Harris County, City of Houston, and earlier this week in Montgomery County, that we are now started to see in our region that we had travel-associated cases. However, the last case and the first case in Montgomery County that I just mentioned was really the first time we hit a significant milestone where we moved from travel associated or a link to somebody who was confirmed as a case to now we don't know where this individual may have been infected or exposed. And that moved us to a different level of now we're not talking about travel associated, linked to cases. We're talking about potential for the beginning of community spread. And community spread is so critical because we are also, again, as was mentioned, that moves us not just in what phase we're in, but it also moves us into what strategies we use in order to combat those different aspects of what's happening. Community spread also implies that you have to take significant steps, not just leaning forward, not just monitoring, not just educating, not just coordinating, not just communicating, but you have to take significant steps. And so both the city and the county declared disasters earlier this week, actually 2 days ago. The disaster declarations enacted a number of powers, not just for the county judge, the mayor, but also the local health authorities, Dr. Percy and myself, respectively, for the city and the county. It also meant that there were a number of other activities that, as was mentioned, we wanted to get ahead of. And that getting ahead of was really very much about the continuation of not just containment meaning you've got a case, you figure out who the contacts are, and then you do everything you can to contain so there's not further spread. And as an example, when we had 4 cases of measles in the county last year, for those 4 cases, we had 400 contacts, individuals that we had to go and assess whether they were at risk to spread to somebody else. This is a very similar notion, except you add anxiety, you add angst, you add concern, you add fear, you add stigma, and you add really a lot of other aspects of this that really mean that myths and rumors are also what we're fighting, in addition to fighting what's happening with novel coronavirus. A couple of days ago, it was very difficult for all of us when we saw that the rodeo was canceled. As you heard, the rodeo news was very big for our community, but as you heard later in the day, when the NBA started to make pronouncements and the NCAAs, we started to see that there was a cascade of potentially economic events and activities that had economic impact and ramifications were also at the same time being canceled or postponed or rescheduled. So yesterday, and I have it in front of me, so just make sure that I have it. I guess I should have been looking at my talking points the whole time. I never do that. I always get to it about an hour into speaking. That we were really, we released a set of guidelines, and I know the city did as well, and there are guidelines, in my understanding, that are going to be regionally from different health departments that are coming out. If they haven't already come out in Galveston, Montgomery, and Fort Bend County, they are in the process of coming out. But our guidelines are really what Dr. Percy mentioned, is really about we are trying to do two things. We are wanting to bend the curve by doing everything we can, working with all of our partners in healthcare delivery and the business sector, education sector, faith-based, everywhere in our community to say, look, large gatherings that are above 250 people, we need to not have those. Or we need to really have people think of alternate means. And as we mentioned, this room usually has 100 people. It's all of you by video. There's only 7 or 8 people in this room. And I do think that that's an example of that social distancing. The second piece of it is that we are concerned about those who are at higher risk. People above the age of 60, people who have underlying health conditions, pregnant women, and certainly people who have weakened immune systems. Because for us, those two aspects of what we're asking our community to do is really important for addressing all the needs in businesses. We really recommend that businesses maximize opportunities for telecommuting, teleworking, anything that really helps continuity of operations, continuity of business, but also helps us continue to keep people away from each other, especially if they're sick, right? So it's one thing if no one has coughed in this room since I've been here, at least for the last 5-10 minutes. However, there is an individual at work who is sick. We want to make sure that individual doesn't continue to come to work. We want that individual to be sent home so that others around that work environment are protected. We also want to make sure that businesses are being very permissive about not just flexible work schedules and telecommuting and all those other aspects, but also with the families of the people that work for you. If there is a single mom or a single dad, if there are parents that have young kids, that have kids with immunocompromised conditions, if there's some aspect of taking care of elderly, taking care of grandma, grandpa, nursing homes, etc., that you are as permissive to your workers to give them the flexibility so they can also help themselves, their families, their communities, their neighborhoods, but also be productive members of your business environment. So with that, I'm going to turn it over to Bob. I've got a lot of other things here that we can talk about, but I want to make sure that Dr. Percy has a chance to come back and we turn it back to Bob for any additional information that we can help with.
Thank you. Thank you, Dr. Shaw. It's great to have you here. Dr. Percy, anything you would care to add to your comments now that you've heard Dr. Shaw? Anything we didn't cover? And I'll give you back the mic for a minute.
I just want to point out that in much of our combined speaking, Dr. Shaw goes first, so I really enjoyed the opportunity to say all those things that I said, to steal a lot of his thunder. So there's a little turnaround at that time. So.
Well, let me wrap this up with this message. As business leaders, your first thought and your first responsibility is for the safety, the well-being of your employees, and that's as it should be. A lot of our messaging has been talking to you as a business manager with respect to your employees. And of course, you're concerned about maintaining operations and meeting the needs of your customer, also very legitimate concerns. But I'm going to ask you to think of yourselves also as community leaders, the kind of decision makers that are going to determine the outcomes in this city. We have to control the rate of spread of this disease. Controlling the rate makes a material difference in our ability to manage this contagion. Our healthcare system only has so much capacity, and if we can reduce the rate of transmission, we can keep this within the capacity of that system. If we don't lower the rate of transmission, this can and could exceed the capacity of our healthcare system, and then you get a situation like you have in northern Italy. So you, as a leader in this community, have a lot to do with this outcome. This idea of social distancing starts with the policies you implement at the workplace, whether it's teleworking, reducing the number of people attending meetings, thinking about travel policies. All these things we talk about will make a material difference at reducing the rate of transmission. So thank you very much for your attention this morning. I do want to bring your attention one more time to our website, houston.org/coronavirus for more information, but also you can feed your questions to us at any time. Thank you very much for your attention this morning. Thank you, Dr. Shaw. Thank you, Dr. Percy, for your leadership in the community and for being here this morning. Good afternoon.